What did ancient humans do with the insane? Picture it in your head. A world with no hospitals, no medication, no understanding of the brain at all. You would assume the mentally ill were abandoned, feared, or worse. Here is the uncomfortable twist. The actual archaeological evidence tells a very different story, and it is stranger than anything you would expect. Let us start with the obvious assumption. Surely a tribe struggling to survive would cast out anyone who could not hunt, gather, or think clearly. Wrong. Multiple archaeological discoveries directly contradict this, and one skull, found in a cave in France, changed how anthropologists think about ancient mental illness completely. Archaeologists studying prehistoric skulls across Europe have repeatedly found something disturbing and fascinating at the same time. Small, precisely cut holes, deliberately drilled into the skull while the person was still alive. This procedure is called trepanation. And here is the part that shocks most people. Many of these patients survived the surgery, sometimes 4 years afterward, based on visible bone healing around the wound. One skull found in France showed evidence of the patient surviving the procedure long enough for the bone edges to fully smooth over, meaning they lived for a significant period afterward, not days, but likely years. So why would anyone deliberately drill into a living person's skull? Some researchers believe ancient cultures may have used trepanation specifically to treat severe mental illness, seizures, and chronic head pain, based on a belief that drilling a hole would release trapped pressure, evil spirits, or whatever they believed was causing the disturbance inside the person's mind. It sounds brutal, but think about what it actually represents. Without anesthesia, without antibiotics, without any understanding of germs at all, someone in that community still attempted a calculated, deliberate medical procedure aimed directly at fixing a problem with the mind, not just the body. This was not abandonment. This was an attempted medical intervention, performed by someone with enough specialized skill to drill precisely into bone without killing the patient immediately, something that required real anatomical knowledge passed down deliberately. A group willing to risk that surgery was not trying to get rid of someone. They were trying to heal them. Here is where this gets even stranger. In many documented hunter-gatherer and indigenous cultures studied by anthropologists, individuals who experienced what we would now call hallucinations, dissociation, or extreme mood episodes were not cast out at all. In numerous cases, they were specifically chosen for one of the most respected roles in the entire group, shaman. This was not a minor position. Shamans often held significant influence over major group decisions, healing practices, and spiritual guidance, a level of trust and authority most ordinary members of the tribe never received. Anthropologists studying Siberian, Amazonian, and North American indigenous shamanic traditions have found a recurring pattern. The exact symptoms modern psychiatry might label as psychosis, voices, visions, dramatic personality shifts, were often interpreted not as illness, but as a spiritual calling. The person was not broken. They were chosen to communicate with realms others could not access. In several Siberian traditions, specifically, a sudden psychological crisis in early adulthood, sometimes called shamanic illness by researchers, was considered the clearest sign that a person was being called into this role, and refusing the calling was believed to bring even worse consequences. Did you expect that? This completely flips the modern narrative. Today, experiencing those same symptoms often leads to isolation, fear, or stigma. In many ancient societies, the same symptoms could lead to becoming one of the most powerful, protected, and essential members of the entire community. Pause for a second and really sit with that contrast. Now, it is important not to romanticize this completely. Archaeological and historical evidence also shows darker realities. Some societies did practice exile, restraint, or harsh treatment for individuals who became violent or dangerously unpredictable. Ancient life was not a utopia of universal compassion. Survival pressure was real, and so was fear of the unknown. What is actually fascinating here is how much variation existed. The same basic human condition, a mind behaving in ways the group did not fully understand, could lead to wildly different outcomes depending entirely on the specific culture, the severity of the symptoms, and how that behavior was interpreted within that group's particular belief system. There was never one single ancient response to mental illness. There were dozens of different responses, evolving independently, shaped by completely different worldviews, all wrestling with the exact same fundamental mystery. How does the human mind sometimes break from what we consider normal, and what, if anything, should be done about it? But here is the key difference from how we often imagine it. The response to mental illness was not usually individual rejection. It was a collective decision made by the entire group based on how dangerous, useful, or spiritually significant that person's behavior was perceived to be. Small tight-knit communities could not afford to make that decision carelessly, because losing or alienating a member affected everyone. Here is something that makes this even more remarkable. Trepanation was not isolated to one region or culture. Archaeologists have found evidence of this exact practice independently across Europe, Africa, South America, and Asia, civilizations with zero contact with each other, separated by oceans and thousands of years, arriving at remarkably similar medical responses to the same mysterious problem. Disturbed mind. Ancient Egyptian medical texts describe head-related procedures alongside spiritual remedies for what they called disturbances of the ka, loosely translated as a person's life force or spirit. In ancient China, some historical medical writings prescribe treatments for conditions resembling severe anxiety and mania using a combination of herbal remedies, acupuncture-like techniques, and structured rest, an approach that, remarkably, shares similarities with certain modern integrative treatment philosophies. Completely separate civilizations, thousands of miles apart, independently concluded that a disturbed mind required deliberate, structured intervention, not simple abandonment. In Peru alone, archaeologists studying ancient Incan skulls found survival rates from trepanation surgery as high as 70 to 80% in some periods. Evidence visible through clean bone regrowth around the surgical site. For comparison, survival rates for similar skull surgeries performed centuries later during the American Civil War were dramatically lower. Ancient surgeons, in some specific cases, were measurably better at this than 19th century doctors. That level of surgical success was not accidental. It required generations of accumulated medical knowledge, careful observation of what worked and what did not, and deliberate teaching from one healer to the next. In other words, ancient humans were not randomly drilling into skulls and hoping for the best. They were running an evolving medical practice, refined over time, specifically aimed at treating conditions of the mind. Healing was not only physical, either. Across numerous ancient and indigenous cultures, anthropologists have documented elaborate community rituals specifically designed around mental and emotional distress. Chanting, communal dancing, controlled use of plant medicines, and extended group ceremonies that could last 4 days. These were not random superstitions. Many followed structured, repeatable patterns, suggesting a refined understanding that mental distress required a different kind of intervention than a broken bone or an infected wound, something closer to what we might now call group therapy, performed thousands of years before the term existed. So what did ancient humans actually do with the insane? Not one single thing. Some were feared and exiled. Some were surgically treated with real medical intent. And some were elevated into the most spiritually powerful role an entire community could offer. The truth is far more complicated, and far more human, than the simple abandoned caveman myth most of us grew up imagining. Maybe we've not changed as much as we think. We still do not fully understand the human mind today. We still debate how to treat it, who decides what is normal, and who gets support versus stigma. Ancient humans were asking strikingly similar questions tens of thousands of years ago, with nothing but stone tools, careful observation, and whatever wisdom they could pass down. Did you know any of this before today? Drop a comment and tell me, which fact surprised you the most? I read every single one, and if you want more videos that take strange, overlooked questions about human history, and actually explain the real science behind them, make sure you are subscribed, because next time, we are answering a question even stranger than this one. I will see you in the next video.